My name is Dawn Collier. I'm a senior staff nurse at University College Hospital. I was part of the team that started the nurse-led bone marrow clinic that we use in our hospital, and I was also part of the team that implemented using the mechanical driver that we're now using routinely as part of our service. A bone marrow biopsy forms part of a diagnosis for a patient. It is an invasive procedure and sometimes quite uncomfortable for patients that we perform the procedure on. It involves taking a small amount of liquid marrow, known as an aspirate, from the bone marrow, and also a core piece of bone called a trephine from the bone as well. From 2010, when we started the bone marrow biopsy clinic, we had 19 patient slots. We performed bone marrow biopsies on these patients using the manual technique only, and one of these slots was used for a sedated bone marrow using lorazepam. The patients that had lorazepam were often in the bed for around 4 hours while they waited for the effects of the lorazepam to wear off, and we needed to find a way to make our bone marrow service a little more efficient. We also had to stop using the lorazepam, so we could no longer offer this to our patients that were either finding the procedure very, very uncomfortable or had had difficult bone marrows in the past. When we switched to using the mechanical driver, we changed completely from the manual system that we use. This is the mechanical driver. It has a built-in battery that's supposed to last for around 60 to 80 procedures, but obviously this will depend on the usage of the driver. If you're using it for quite difficult procedures, we're using it quite a lot, then it'll be less, and obviously if you're using it for quite straightforward procedures, we can get more than 80 bone marrow biopsies from using one driver. The needles for the driver come supplied in a sterile kit, and we use a separate kit for every patient. We don't use the driver for our patients that only require an aspirate, a liquid sample of bone marrow, but they're only used for patients that need an aspirate and a trephine bone marrow. From May 2017, once we introduced the driver and looked at how it was working in our clinics, we were able to increase the number of slots that we offered to our patients from 19 to 24. We were able to increase our number of bone marrow biopsies in 2020 to 30 slots per week, once the driver was well established into our clinics. Between January 2017 and April 2017, we trialled the driver, carrying out an audit to see how successful the driver would be compared to our normal manual technique. The audit looked at a total of 56 patients, split equally between the driver and the manual technique tools. Our labs looked at the samples that we sent over following the biopsies, using a blind testing technique, so they were unaware of which type of equipment was being used for each individual sample sent across, and the samples were analysed by the lab, and the findings were presented at our haematology governance to the medical teams who were usually referring their patients to us for the bone marrow biopsies. We have a list of the various patient groups that were used as part of the bone marrow biopsy audit, a variety of patients from leukemias to diagnostic and trial patients were included. Our lab had a list of standards and criteria that they were using to analyse the samples that came over from the bone marrow biopsy clinic, and they weren't aware of which ones were the manual and which ones were using the driver. The criteria that they used were to assess whether or not there was a poor quality sample sent across, so therefore unable to take any major findings from it, whether the sample was adequate and they could get good results from it, and whether the aspirate sample correlated with the trephine sample that had been sent across at the same time. We have some findings from the lab regarding the aspirate samples that were sent over, and as you can see from these findings, there was a significant increase in the success of our bone marrow biopsies using the mechanical driver. There was only one out of the 25 samples that we sent over from the driver samples that was seen as an inadequate sample. When we used the manual technique, there were approximately 8 samples that were sent across that were poor quality. Therefore, the lab concluded that the aspirate samples were much improved by using the mechanical driver. When the lab looked at the trephine samples, they found that even though we were already performing quite well with the trephine when we were using the manual technique, the driver just lifted that slightly so that we had an even better performance with our trephine samples with the marrows that were performed using the mechanical driver. The lab looked at the samples using quite a scientific basis, but also we wanted to find out how patients felt when using the driver on them as opposed to the manual technique, and also for the user to find out, the person doing the bone marrow procedure, if they found it better using the driver or using the manual technique that we'd used before. We used a very small evaluation form because after the procedure, when the patient had to fill in the details, We didn't want them to have to fill in loads and loads of questions when they were still quite uncomfortable following a procedure. So it's a very small evaluation form which literally looked at the pain score for the patient and whether they'd had a bone marrow biopsy before so they could make a comparison for us, or whether or not this was a new procedure for them, and if there was anything specific that they found uncomfortable or good about the procedure. For the user that was actually carrying out the bone marrow biopsy, obviously they'd had experience of using the manual technique for quite some time, so we wanted to find out if there were any problems in the mechanics of using a new piece of material to make the bone marrow biopsy an easier technique, or whether they found that it was actually harder to use it. When we looked at a number of the patients' comments that came back, many of the patients that had had previous bone marrows using the manual technique told us that they found this much more comfortable. They found it much quicker than the manual technique would be, and quite often some of the patients were actually requesting to have the driver used when they came back for subsequent bone marrows in the bone marrow clinic. The users said that they found the technique much nicer for the patient. Visually they could see the patients were finding it much more comfortable, that the samples that they were taking, particularly for the aspirate, when they made their slides, they could see that there were particles within their slides, and they could see that the quality was good when they took the slide samples for the lab. They also found that the use of the driver was much more comfortable for them because there was much less pushing on their arm when they were trying to get the samples, which is what you had with the manual technique. In our nurse-led clinic, when we perform our bone marrow biopsies, we always perform them using the superior iliac crest, either on the right or left side of the body. We perform our bone marrow biopsies for a variety of indications: newly diagnosis, for trial patients, for staging, for various reasons that are referred to us by various clinical teams. When we perform a bone marrow procedure, it is an invasive procedure. It does involve making a hole in the skin to get through to the bone. If our patients are on anticoagulants, we need to make sure that they have either stopped those anticoagulants to prevent excessive bleeding following the procedure. Most of the medical teams will make a decision to put some sort of bridging plan in process. If it's a maintenance dose of something like aspirin, we would just continue with the procedure without having to stop the anticoagulation. It's up to the individual teams to ensure that their patient has a sufficient program in place. The bone marrow procedure is invasive, and some patients will always find the procedure uncomfortable. We don't routinely offer painkillers for our patients, and we definitely don't offer sedation anymore because we're not allowed to use it. Therefore, if they do find it uncomfortable, we are able to offer them Entinox or nitrous oxide gas. This is a short-lasting gas that they start to inhale at the beginning of the procedure, breathe in during the course of the procedure, and stop as soon as the procedure is finished. It's quite effective for the patients, and we find that it makes the procedure a little bit more comfortable for them. If a patient needs to use the Entinox, there is a checklist of items that we need to look at with the patient because there are some contraindications for using nitrous oxide. Before a patient undertakes the procedure, the person that's about to perform the bone marrow biopsy will make sure that they have a consent form to ensure that the patient is aware of all the elements of the procedure, and also to make sure that they're aware of any problems that may come from the procedure, such as bruising, infection, which is always a possibility when you're making a hole in the skin. There might be some bleeding. To manage our patients pre their actual procedure, the teams will make sure that they have a referral put onto our system, which is currently an electronic system. The patient must have their consent completed. They should have a full blood count taken before the procedure or within 7 days of the procedure, because this is often used alongside the bone marrow aspirate and defined sample that is sent to the lab. And we must make sure that there's no contraindications for the patient for the procedure. When we're going to do the bone marrow biopsy, once the patient is consented and everything is prepared, we make sure that our trolley is set up with all the equipment ready to go. The procedure is a sterile procedure, so you need to make sure that all your equipment is at hand when you're about to start. Once you've confirmed that your patient is happy to go ahead with the procedure, you position them onto the bed, lying on their side with their knees to their chest, to enable you to be able to find the landmarks of the iliac crest to see where you're going to perform your biopsy. If they're going to have the Entinox gas, then you would start this so that they start to get the painkiller into their system. You would have a little feel of the area to find exactly where you want to go, and then you will be cleaning the area ready for the procedure. We use lidocaine 2% to numb the area before we go in to perform the bone marrow biopsy. We first make an intradermal subcut injection of the lidocaine and then further down with more lidocaine to the surface of the bone to make sure this area is nice and numb before we start the procedure. Normally we numb it around a small coin-sized area on the surface of the bone to make sure that this is most comfortable for the patient when we go in with the actual bone marrow needle. You need to make sure that you let your lidocaine work, so this is usually around 3 to 5 minutes before you start to actually perform your bone marrow procedure. So when we're taking an aspirate sample using the manual technique, once the area that we're going to use is nice and numb, you will take your manual tool, you insert the needle into the skin down to the surface of the bone. Once you're satisfied that you have a nice firm area of bone, you start to twist the manual needle into the bone through the cortex until you feel what is called a give. It moves from a hard area to a sudden soft area. You can feel the movement when you push the needle in. Once you feel that movement and you're in the right place, you take out the inner needle of your manual tool, you will attach a syringe to there, and you will take a pull. Your aspirate should come up. It's a liquid, looks just like blood. You want 2 mils quite quickly taken because this is the most particulate part of your sample and that you will use it to make your slides. Once you've taken your liquid sample, you will remove your syringe, reconnect the top of your needle for your manual tool, and continue to push further into the bone to take a piece of the bone for a trephine sample. Once you feel like you've got around 2 centimetre piece of bone, you will then wiggle your manual needle out, taking it out of the bone and removing it from the patient. If you're using the driver, it's exactly the same technique up to the point of numbing the skin. Whilst you're letting that area numb, you can then prepare your kit for your bone marrow biopsy. They're all sterile, they all come individually for the patient, so by the time that you've unwrapped your driver kit and are taken out all the attachments, your patient should be nice and numb, ready for the procedure to proceed. You would attach your needle to your driver in exactly the same way that you did with your manual technique without switching the driver on. You would put the tip of the driver needle into the skin and work your way through down to the surface of the bone. Once you're aware that you're in the right place and you've got a nice hard piece of bone that you're going to take your sample from, it's at that point that you will actually put your finger on the trigger of the driver, and using a steady pressure, you will push the driver into the surface of the bone exactly the same way as you did for the manual. You will feel your driver needle go through the cortex into the actual marrow, and you'll feel that give again as you go through. You disconnect the driver from the needle. You will attach your syringe in the same way that you did with your manual technique, and you will again pull out your aspirate sample with the syringe. Perform your slides, take out any further aspirate samples that you need. You would then reattach your driver to the top of the needle. With the driver, it has a gauge on the end of the needle, so you can see 1-2 centimetres, whatever you feel that you need to set that to, and you will then, with more steady pressure, go further into the bone to take your trephine sample. Once you're in the bone, you need to use a smooth movement, straight in and straight out with your driver, and this should release the trephine sample for you. You would then disconnect the driver from the needle. You would be able to remove your sample of the trephine into a biopsy pot, and then you just need to check that your patient is okay, that there's no bleeding occurring, and then apply a plaster to the area. We generally ask our patients to remain for about 10-15 minutes post-procedure to make sure that there isn't any further bleeding once the biopsy has been completed. And this also gives us time to write out all the sample pots and things that we need to do to make sure that the samples go off to the right areas. We'll check the dressing before the patient goes, make sure that they have any advice about what to happen if there's any complications when they get home, or if there's any worries, and make sure they have contact numbers if they need to, if they have any concerns. The samples are then sent off to the lab. We then dispose of the elements of the driver that we need to and prepare the actual drill piece ready for the next patient.